Many of us struggle with our weight because of many different factors. There's, of course, a genetic component in many of our family histories, metabolic issues sometimes. Certainly environment comes into play, the kinds of foods you've grown up eating, the kinds of foods that surround us every day, advertising, and just physiological effects as well. So it's really more complicated than just pushing away from the table. This is where the medicine really does help, because it works in one aspect of managing this condition of obesity, overweight. It works in the central nervous system, or the brain. It changes a little bit of the brain chemistry to reduce your hunger, and it just gives you back some control. It makes you full faster. So most of us in this country have learned to eat too much, and so this gives you a control of portions and gets us back down to perhaps where we should be. We find in this clinic that it really does make a difference. It's so much easier to make the nutrition changes and the lifestyle changes and the other things that have to happen for weight management. It's much easier when you're not hungry or you're not craving, and that's where the medicines really make a difference. Appetite medicines in the medical profession they're a class of medicines called anorectics, and there are several in that class of medications. So those are the tools that we have in our toolbox to help patients. Medicines are used to curb appetite and to give a little more control to the patient to make the changes that are necessary for the successful weight loss and weight management. So we use medicines on an individual basis. We prescribe them accordingly to the individual patient as to the dosing and the type of medicine that would work best in their lifestyle, in their life and their schedules and everything that goes on. So there's a lot of factors that come into play when we decide what medicines to use. The one that we use the most is phentermine. It's probably known the most popular used. It's one of the top 3 medications prescribed in the state of Texas in the last few years. There's a lot of misinformation about phentermine and the other medicines that are in this class. When the FDA approves a medication, it's supposedly safe. And so the phentermine was approved in 1958. So it's been on the market a long time. If you really look at the medical literature through those almost 70 years, there really is not very many negative outcomes. And if you compare it to much of the over-the-counter medication that we freely can buy, it's actually safer than many of the stuff that we don't need prescriptions for. We feel confident in using this medication to help the patient succeed. These medications help you control your appetite so that you can make the changes that are necessary for success in weight management.